Matt London is our next speaker. He is a health and safety specialist with the New York State Public Employee Federation. Matt?
Thanks for the opportunity to briefly describe the importance of violence in the workplace and some of the things that our union has been able to do. I work for PEF, a public sector union that represents many professionals who work for New York State government agencies. Our members provide vital services to the community, including to citizens who may pose a significant risk of violence. Dr. Coe and Ms. Castillo described many of these work settings. The union's role is to not only bargain over salaries and other aspects of compensation, but also over working conditions, including workplace health and safety. This table describes the high annual incidence rates for direct care workers in the state's Office of Mental Health. The aides have virtually full-time contact with patients, and the category secure aides work in forensic hospitals. Jill is a psychiatric nurse who is working at a state-run psychiatric center. She was brutally assaulted by a patient who had a long history of violence. Jill was working alone, and it wasn't until another patient heard Jill's head being bashed against a wall that a call for assistance was made. Jill's boss callously told her that the patient had nowhere else to go and thus would remain there. The local police informed her, quote, "You knew that it was risky when you took the job." Jill missed 2 months' work, but the trauma remains to this day. It was 2 years later that another PEF psychiatric nurse was murdered. Judy was working alone, conducting a home visit to a patient. She had not been informed of this patient's relevant history and was brutally murdered with a hammer. As a result of the statistical toll, as well as the human impact personified by Jill and Judy, PEF began to focus on workplace violence prevention in the late 1990s. Our first priorities were to provide support to our injured members and to learn more about the problem. We joined with the University of Maryland School of Nursing and obtained a NIOSH intervention research grant looking at workplace violence in psychiatric settings. We were later able to parlay that into a similar grant studying the problem in social service settings. The goals were to document the problem of workplace violence in those settings, identify risk factors, and begin to develop prevention strategies. Our first step was to partner with sister unions and with management in those agencies. We used participatory action research methods, believing that the frontline workers themselves had valuable information to provide. After getting increasingly immersed in this work for 6 to 7 years, PEF decided to launch a public health-style campaign to tackle the problem of workplace violence. Using the knowledge obtained from the NIOSH research, PEF convened a series of day-long sessions around the state. PEF targeted those members who worked in high-risk settings, as well as those who were already on a union health and safety committee or in a leadership position. The goals were to educate them on the issue and to mobilize them into taking action. The union worked with legislators to draft legislation and launched a campaign. This included telling the workers stories to the press, testifying at hearings, and holding rallies. While the campaign utilized injury and cost statistics, we also wanted to put a human face on the problem. PEF developed a booklet that included photos of 10 assaulted workers post-assault, as well as the victims telling the story of what happened and the impact of their assault. Many of these brave members participated in the trainings and in the advocacy. Their personal testimony was very powerful. The day-long trainings were very successful. Virtually all the attendees became engaged in the issue, both raising the topic in their workplace and also participating in the legislative campaign. With the assistance of PEF's members and sister unions, the law was passed in 2006. This comprehensive statute covers virtually all public employers in New York State. It's administered by the state OSHA plan through the State Department of Labor. Employers are required to assess the risk of workplace violence and identify and implement risk reduction strategies. It requires that a system be utilized for recording all workplace violence incidents, and it requires that all employees be trained in the various elements of their employer's program. Unlike other workplace health and safety regulations, the concept of workers as experts is explicitly recognized, and union representatives and frontline employees must be included in the development and implementation of the program. These regulations took effect in 2009. The regulations draw heavily on NIOSH and OSHA's research and guidance documents that Dawn described earlier. They state that successful workplace violence prevention programs start with the commitment of top management and with extensive employee involvement. The risk evaluation is critical to ensure that prevention efforts are effective and appropriate for that particular workplace. Unfortunately, at this time, we have little reliable data that demonstrate a specific reduction in workplace assaults. This is due to the recency of the law, non-uniformity in data collection methods and formats, and a presumed increase in reporting due to the requirements of the law itself and to increased awareness of the problem. However, we know that there's been a dramatic increase in workplace violence prevention efforts. Our advocacy and education and the power of the law have resulted in most public employers focusing on this issue, many for the first time. NIOSH has described the various sources of workplace violence. In addition to patient or client-perpetrated incidents, we've also begun focusing on coworker conflict and workplace bullying. Partnering again with the Maryland School of Nursing, we obtained a NIOSH research grant focusing on coworker conflict and bullying. As with our other work, we've partnered with sister unions and with employers. Working with 5 state agencies, we offered a survey to all of their employees. As you can see, we obtained almost 13,000 completed surveys with a very high response rate. Using a battery of questions derived from the work of other leading researchers, just under half of all respondents reported experiencing at least one of these 6 negative acts at work during the prior 6 months. Using a standard definition, 10% indicated that they had been bullied at work during that period. Those who had been bullied were severely impacted, both at work and at home. The more frequent the bullying, the more serious the impact. Now, how do we reduce coworker conflict and bullying? While there are measures that individuals should take, we're also trying to identify organizational causes and responses. We recommend that employers develop policies with clear norms of behavior. An explicit system for reporting and investigating complaints should be created. Some elements of that system are described here. Additionally, the organization should reduce stressors to the extent feasible. These include job insecurity, mandatory overtime, etc. Finally, supervisors play an important role. In most organizations, supervisors are not selected for their ability to manage people, nor are they trained or evaluated on that ability. This, we believe, contributes to many of the problems, both from bullying bosses, but also from managers who are incapable of managing. So what have we learned? The NIOSH-funded research conducted with the University of Maryland continues to inform PEF's work and advocacy on this issue. We've been able to accomplish what we have by working in coalition. The enactment of strong regulations has resulted in a significant increase in worksite-based violence prevention activities. This problem will likely never be fully solved. Thus, the programs need to be evaluated and updated on a regular basis. No matter where you work, workplace violence should never be accepted as part of the job. Unfortunately, the problem continues. Not long ago, Mark, a teacher in a youth detention facility for girls, was assaulted by one of his students. Only with ongoing attention to the problem will significant improvements occur. Though difficult to do rigorously because of myriad confounders, evaluation studies are critical. Worker safety is inextricably linked to the safety of the individuals being served by our members and to that of the public at large.